Our youngest daughter was about 4 years old when I got sober. When I had her in the hospital was the first time that I had ever taken prescription opiates. And about the same time, he had a knee surgery. You know, blue collar family with 3 kids, just a normal family.
And we think we can do anything.
13 years of recovery.
Over the course of that 4 years, we found ourselves completely addicted.
So let your heart not be troubled. Don't let it be afraid. I mean, I remember those moments. And I mean, that scripture is what got me through.
And that's something we got from you. So again, as I said before,
it's not failure to admit that you need help. It's being human. They come into the clinic here. We can help them with detox meds, connect them to the recovery community. There's a lot of different definitions for addiction. We know for sure that there is a rewiring that occurs in the brain. There's genetic predisposition, it goes into community, disconnectedness, isolation.
One of the problems of all the common chronic health conditions that we deal with in medicine, addiction is the most poorly understood and poorly treated by the average physician. It's a chronic health condition, and like other chronic health conditions, whether they're diabetes or COPD or coronary disease, epilepsy, anything that is a long-term health condition, many of those are not often viewed as curable, but they're well managed by many patients and their caregivers. We talk about counseling and support groups and medication and accountability and healthy living and spirituality, having goals. Those are some of the main tools that we emphasize. Rebuilding your support network, having a healthy environment, reducing the famous people, places, and things that act as triggers or relapse issues for individuals.
I'm a professor of psychological and brain sciences at Indiana University. What we're doing is looking specifically at certain parts of the brain, trying to understand what they contribute to addiction, and relatedly, how can we intervene directly with those brain regions, intervene at the neural level to make it easier for people to withstand the cravings, to get past them.
Back in the 60s, 70s, and 80s, we saw people go to 30-day treatment programs, and those programs are still around, but you were sort of expected to go to a 30-day rehab, so to speak, and walk out and be cured, never use again. And the treatment didn't look like the disease. We were treating a chronic illness as if it were sort of an acute illness. The treatment of addictions has now moved into the era of treatment like diabetes, and medication is a definite part of that, and they're tremendously underutilized. We know from science and research that outcomes are tremendously improved when medication is part of the treatment plan, especially if the patient has opiate, tobacco, or alcohol problems.
Society labels alcoholics or addicts as these voodoo type of people. It's a stigma that goes along with it.
It hurts when you know what you've been through and people still call you worthless. You're just a junkie. You're better off dead. I know that I've done a lot of bad things, but it also kept me away from wanting to try to better myself.
Stigma is defined as a deeply discrediting attribute. And the process of stigmatization is a social one, where people who have a particular condition are devalued. Stigma is a major barrier to treatment seeking. There's this shame and this secrecy, which causes people to not seek treatment when they need it. My colleagues and I are involved in several projects that are funded by the Indiana University Grand Challenges. And these really sort of try to triangulate on the problem of opioid use in Indiana and how we can best provide access to services and reduce the secondary harms associated with stigma.
Most commonly, people seek help because the pain level is starting to exceed the fun level, so to speak. In other words, there's some type of a crisis going on. So substance use disorder can cause a number of different problems for people. Some people think that that means that maybe their outcome won't be so good because the motivation seems to be external. And actually that's just par for the course, and it's human nature. You know, we change our behavior when that behavior starts causing distress and pain, and that's just the way we are. But the job of treatment is to convert external motivation into internal motivation, to help the person see that these problems in their life, that they're all connected, and they're connected to a condition that isn't going away.
I've been sober since May the 15th, 1998. I'm a licensed addiction counselor also. When I became educated about it, it took away from me that I was a failure. When I started understanding that I wasn't a moral failure, I've always encouraged individuals to go to 12-step meetings, get a sponsor, work on lifestyle changes.
I didn't want my marriage to end. And I was like, man, you gotta meet Charlotte, you gotta meet he's just so cool, he's spiritual, but yet he's real, he's authentic.
We meet every Saturday at 2:30, no matter what. What we offer here is the spiritual concept of it, because the reason that a lot of them go back out and use, they never found that spiritual aspect of change.
Once we come in, we have a song, a scripture, and a prayer. Then we open up the floor to a topic or a subject or whatever is on anyone's heart.
The first time I came into this room, I was told I was loved. I was told that I could recover.
It was maybe about 5 weeks into recovery. I was still just hurting so badly. I came to Lazarus Generation for the first time, and it was just like, I'm home.
You can be sober and not be in recovery, but the recovery that we got and the fellowship and the love and the hope that we got from the Lazarus group was unlike anything I'd ever experienced up to that point. I've never left that meeting without something. A little bit of hope or strength and fellowship.
Fellowship and hope. Those two things for sure helped solidify coming up on 13 years sober for sure.
There's not one person, not one, that I can meet that I don't believe that can have a chance. And I'll keep doing it until the day that I just don't have any breath left in me, because it's well worth it.